The ground glass pattern, which is usually seen early in any type of interstitial lung disease, don't just mention it, but interpret its type. If it is diffuse in pattern, suggests inflammation in origin. If it shows peripheral distribution, this appearance raises suspicious of early fibrosis. Finally, if T is patchy in pattern, diagnosis is hypersensitivity pneumonitis. From the previous slide, the first sign to search in interstitial lung disease is ground glass pattern. If you find it, try secondly to search for reticulation, because if it is present, this is a red flag for early sign of fibrosis, dual sign of diffuse interstitial lung fibrosis. If reticulation is not present, look for other causes of ground glass pattern such as interstitial edema or pneumonia and so on. If honeycombing is present, this is the second red flag, as it gives bad impression that the case is in the late stage of pulmonary fibrosis disease, triple sign of diffuse interstitial lung fibrosis. Regarding interstitial lung disease, distribution of the lung is everything. The lungs are telling a story. Your job is to read the map. If interstitial lung disease is basal and subpleural, it will be usual interstitial pneumonia. And if it is in the upper lobes, it will be either sarcoid or hypersensitivity pneumonitis. Lastly, if it is in a peribronchovascular distribution, it will be non-specific interstitial pneumonia. One of the biggest mistakes is waiting for honeycombing to diagnose lung fibrosis. By then the disease is advanced. The real skill in radiology is catching interstitial lung fibrosis early when the signs is subtle. This is where radiology truly makes a difference. Early detection can change everything. It guide treatment, cause slow progression, preserve lung function. We can summarize lung fibrosis in the following steps. First of all, search for ground glass pattern opacities, which should be peripheral in distribution. Secondly, search for reticulation, which is the early sign of fibrosis, putting in consideration that missing this stage means missing early diagnosis. Late in the disease, honeycombing is noted, which is the late sign of lung fibrosis. The real skill in radiology is catching interstitial lung disease when the signs is subtle before its transformation into lung fibrosis.